I'm Dr. Amani Jambakar. I'm a fellowship trained breast surgical oncologist. And let's talk about what to bring with you at your first appointment with a high risk breast clinic or a genetic counselor to evaluate your future breast cancer risk. For background, this is an MRI of a patient who went to go see a high risk breast clinic. She didn't feel anything in the breast, but they ordered an MRI for surveillance because she did have a high risk family history and her lifetime risk of breast cancer was more than 20%. And it detected this cancer. And that's really the goal of an appointment with a high risk breast clinic, is to find out if you should be getting things like genetic testing or potentially MRIs. So the most important thing to bring to a visit like that is your complete family history. Before the visit is the time to go and talk to your relatives, your mom, your dad, your aunts, uncles, grandparents, about if they were diagnosed with cancer. It's important to know what type of cancer, and if it was breast cancer, if it was triple negative breast cancer, which is an aggressive type of breast cancer, if the cancer was in one or both breasts, or if it was lobular breast cancer. If someone in the family was diagnosed with prostate cancer, it's important to know if that prostate cancer was high risk or spread outside the prostate to other parts of the body. Now, some of these details you may not be able to find out from family members, but do the best you can. When you're giving that history to us, start with your closest relatives first. For example, I've had patients talk to me about how their grandmother's sister had breast cancer, and then later in the visit mentioned that their mother had ovarian cancer. And if you have any prior history of having had a breast biopsy, bring all of those records with you so we can see what those pathology results showed. All of this is important in a visit in which we're assessing what your risk looks like and whether or not you meet criteria for genetic testing and your insurance will cover it. Now, I understand that not everyone knows their family history, and sometimes you may go and ask your relatives and they won't tell you. There are also some families where it's considered taboo to talk about cancer. So come prepared with all of the information that you can. Write down all the relatives that you do know about and what age they were diagnosed, and we'll take it from there and work through it together.